Hello, everyone. It looks like our numbers are starting to settle, so I think we'll go ahead and get started. Good morning and good afternoon, depending on where you are. Thank you so much for joining us for this webinar. I'm Ruth Friedman. I'm the Director of the Office of Child Care in the Administration for Children and Families at the U.S. Department of Health and Human Services. I'm very happy to be here with you to talk about our notice of proposed rulemaking for the federal child care program, the Child Care and Development Fund, or CCDF. This webinar is one of the ways we are engaging the public in this proposed rule. In just a few minutes, we're going to be also joined by Megan Campbell, an invaluable member of our great team here at the Office of Child Care. And together we are going to present highlights of the proposed rule, this NPRM, and talk about how you can submit comments. So I suspect everyone on this call well recognizes that childcare is a necessity for most families in America with young children. Without it, parents can't work or go to school or get the job training they need. And that's why reliable access to childcare increases parents' earnings, their education, their full-time employment, and their overall labor force participation. Yet most families struggle to afford high-quality childcare that meets their needs. Childcare is simply too expensive for most families, and there simply isn't enough of it available throughout the country to meet what families need. But at the same time, childcare programs are barely making enough to keep their doors open, and the sector is having to rely on an incredible and dedicated childcare workforce, but one that receives little compensation for the essential work that they do. We frequently hear stories these days of childcare programs losing staff or having trouble recruiting because people can make more money in fast food and retail jobs. Yet the work that childcare providers do is vital to our children's development. It's essential for parents, and it's a driver of our country's economic engine. That's why the Biden-Harris administration's budget included major new investments in childcare so that every family in America can find and afford the childcare they need. And that's why the president announced an executive order this past April on increasing access to high quality care and supporting caregivers. This NPRM builds on that executive order by making key proposals to strengthen our very important current federal program, the Child Care and Development Fund, for the 1.5 million children it serves and the 230,000 child care providers that participate. So I do want to be clear before we start diving into the NPRM, the proposed rules we're going to be talking about today are focused solely on the Child Care and Development Fund program and the families and providers participating in the program. This is an $11.6 billion federal program to state, territory, and tribal governments that helps working families afford child care. And as I mentioned, it serves about 1.5 million children and their families every month. So the goals of this NPRM that was published today are to lower child care costs for families receiving CCDF, to increase their child care options so they are more likely to access the child care they need, to strengthen payment practices to providers to help stabilize their operations, and to encourage more family-friendly practices that will make program enrollment easier and faster for families. We believe that when enacted, the proposals in this NPRM will mean more families will be able to find and afford childcare that meets their needs and create better economic stability for their families. More children will be in higher quality childcare that supports their development and helps set them on a more positive track in life. And more providers participating in this program will receive fairer and more stable support for the essential and important work that they do for children, families, and the communities they serve. And with that, I am going to turn it over to Megan next.
Hi, Ruth. Thanks so much. Hi, everybody. I'm Megan Campbell. I'm a child care policy supervisor in the Office of Child Care. And before we dive into the details of what's in the NPRM, we want to provide some general background on Notice of Proposed Rulemaking, or NPRMs, for those of you who may not be familiar with the process. When the federal government wants to make new program rules or change existing rules, they have to first publish them in the Federal Register and seek public comment. So our proposed program rules went live on regulations.gov on Tuesday for viewing and were officially published this morning on the same website. There you will find the proposed changes and the reasons for those proposals. The public will have 45 days from today to submit comments on the proposed changes. That means comments are open through August 28th, 2023. After that, the Office of Child Care and the Administration for Children and Families will review all of the comments and work to issue final regulations that will then be enacted by state, tribal, and territory governments. I do want to note that we are not permitted to answer questions about the NPRM that are not directly addressed in the NPRM. I know that can seem frustrating, particularly for our states, territories, and tribes that want to speak with their Office of Child Care Program Specialists about the NPRM. But federal rules prohibit it because it can give some stakeholders more information than others. And we want to ensure an equal opportunity for everyone to comment on the NPRM. It's also the reason why there isn't a chat feature on today's webinar. We will have more information on how to provide comments at the end of this webinar, and you will also find instructions on how you can submit those comments on these proposals in the NPRM itself. Now I'll turn it back to Ruth.
Thanks, Megan. So as I mentioned previously, this administration is very focused on lowering the cost of childcare for families. We know that high childcare costs can mean families have to choose between other necessities, and that high childcare costs can force parents to reduce their work hours or leave the workforce altogether. Even for families participating in CCDF or wanting to participate in CCDF, family co-payments can be a real financial strain that harms the economic well-being and family stability and can be a barrier to participation at all. So we have a number of proposals that Megan's going to walk you through to lower the cost of childcare for families participating in the child care subsidy program.
Okay, so first, the NPRM proposes to cap parent co-payments at 7% of family income, which aligns with the maximum affordability benchmark for co-pays that HHS set back in 2016. Under CCDF, payment to providers is a combination of the state payment plus a parent co-payment. And also under CCDF, states have the flexibility to set how much parents pay through that copay, but the law does prohibit parent co-payments that would be a barrier to childcare access for families. So the total amount going to the provider for this proposal would not decrease, but we would be lowering costs for parents benefiting from CCDF. This would shift the costs from families to the CCDF program. Right now, 25 states have some parent copays above the 7%. The NPRM also proposes to make it easier for states to entirely waive copayments for families with incomes below 150% of the federal poverty level. That means for families with a family of four with an income of about $45,000 a year. The current regulations allow states to waive copayments for families with incomes below the federal poverty level and for other factors as identified by the states. By proposing to identify copayment waivers for this group of families, those with incomes below 150% of the federal poverty level, this rule would make it easier for states to lower childcare costs for more families benefiting from CCDF. We really want to emphasize that this proposal should not be interpreted to mean that states can't waive copays for these families right now, but we want to make it easier for them to do so as we look ahead, and so that more states will take advantage of this program flexibility. Similarly, the NPRM proposes to make it easier for states to waive copayments for families with children with disabilities. We know that families with children with disabilities experience unique and extra challenges to finding appropriate childcare. We believe this proposal will give states an additional tool to help meet the law's requirement to prioritize providing services for children with disabilities. Similar to the proposal to allow waiving copays for families with incomes below 150% of the federal poverty level, states may already be able to waive the copays for families with children with disabilities. And the Office of Child Care encourages them to implement this policy now, But through this proposal, we're hoping to make it easier for states to take advantage of this flexibility and institute it.
Okay, so we will be holding another webinar tomorrow at noon Eastern time, specifically focused on how the proposals in this NPRM would impact our tribal CCDF programs. Tribal CCDF programs run under slightly different rules than the state and territory programs. So we encourage you to tune in to that meeting tomorrow if it's of interest to you and your work. But in the meantime, we wanted to point out that one additional proposal in this NPRM would allow tribal nations to choose to waive co-payments for all families that participate in their CCDF program. So moving on to our next set of proposals, these are aimed at strengthening the payment rates and practices that state programs use to pay participating childcare providers. We believe these fair policies for childcare providers will help stabilize their operations, make it easier for more providers to accept families with subsidies, and provide more options and choice for those families participating in the CCDF program. As I mentioned before, we know the availability of affordable, high-quality childcare that meets families' needs continues to lag well behind demand. This can make it really hard for families to find the childcare that they need and they want. Childcare is incredibly labor intensive and parents simply can't afford to cover the true cost of care. Supporting parent choice, which is a really central part of the CCDF law, means making sure that parents have the options they need to meet their needs. Yet the lack of childcare supply keeps it from being a reality for too many parents. We believe the situation is at a point where we must act more aggressively. So we want to make sure that CCDF policies are properly designed to support parent choice, which is one reason that the law requires that state payment practices to providers generally reflect accepted payment practices for children served by private pay. And so these next proposals that Megan is going to walk you through, that is what these proposals are meant to do.
Thanks, Ruth. So for the first one in this area, the NPRM proposes to require states to ensure timely provider payments by paying prospectively, meaning at the beginning of the delivery of childcare services. In most of the private pay market, families have to pay at the beginning of the week or the month because providers need to receive payment before services are delivered in order to meet payroll and pay rent. The law requires states to use generally accepted payment practices, but most states are still paying providers weeks after services are provided. This is extremely destabilizing to childcare providers and makes it difficult for them to accept subsidy payments from families. It is an upfront burden for providers, and it is often reported as a key reason why providers may not participate in the CCDF subsidy program. Ultimately, slow payment practices keep families from having the childcare choices and options they need, and in turn run counter to the requirements of the CCDF law. So the NPRM requires states to make prospective subsidy payments to childcare providers to make sure that they are paid on time. The NPRM also includes a proposal to require states to use enrollment-based payment instead of attendance-based payments. The fixed costs of providing childcare, including staff wages, rent, and utilities, do not decrease if a child is absent. That's why private pay families are generally required to pay for a full week or month, regardless of whether their enrolled child is absent occasionally. Providers in states that pay based on attendance either have to absorb the lost revenue associated with occasional absences or choose not to participate in the subsidy program at all. CCDF requires states to support the fixed costs of providing childcare services by delinking payments for a child's occasional absences, but the current rules simply do not do enough to ensure stable childcare operations and for parents to have childcare options to meet their needs. We are proposing to require that all states offer some grant or contract funded options to parents, at least for particularly scarce types of childcare, especially for infants and toddlers, care during non-traditional hours, and care for children with disabilities. The law requires parents be offered childcare subsidies via vouchers and grants or contracts. This provision gets at one of the law's central purposes, that parents have options and choice when it comes to childcare, and that parents should not be limited because they participate in the CCDF program. Grants and contracts represent agreements between the subsidy program and childcare providers to designate space to serve subsidy-eligible children. Well-funded grants and contracts for direct childcare services increase stability for childcare providers and help them remain in business. Research shows that grants and contracts are one of the best ways to build supply, and they can make a real difference in hiring and retaining qualified staff. Right now, most states just offer vouchers. The NPRM requires states to use some grants or contracts for certain types of scarce care that I mentioned and outlined in the slide, but it remains flexible on how much states would need to offer. CCDF requires states to set payment rates for providers that allow families participating in CCDF to have equal access to childcare as families who do not receive subsidies. CCDF allows states to pay providers at this full established rate, even if it is more than the established rate the childcare provider charges families. This is an extremely important principle in childcare policy because the price of childcare is dictated by what parents are able to afford, not the true cost of providing care, which is higher than what most families can pay. This broken market system undermines provider stability, dampens childcare supply, constrains childcare wages, and can make high-quality care out of reach for many families. This disconnect between the price of care for families and the cost of providing childcare is one reason the Office of Child Care has previously instructed states that they are allowed to use CCDF funds to pay providers the state's full established rate, even if that rate is higher than what parents in their communities can afford. Because of the importance of that policy for meeting the needs of children and families and supporting the stability and quality of childcare providers, this NPRM proposes to make clear in the regulations that this is an allowable use of CCDF funds and is strongly encouraged.
Thanks, Megan. So the last main set of proposals in this NPRM are meant to make it easier and faster for families to enroll in state child care subsidy programs. We know that families can miss out on benefits because of administrative challenges rather than eligibility issues, and we want to eliminate this problem as much as we can. Enrollment delays can lead to families being forced to turn down or delay jobs or education or training opportunities, and we just do not want bureaucracy to stand in the way of parent employment or family well-being. For that reason, we are proposing to make it easier for states to use presumptive eligibility policies in CCDF. The NPRM would allow states to consider a child presumptively eligible for subsidy prior to full documentation and verification of the state's eligibility criteria and determination. To be presumptively eligible, a child must plausibly be assumed to meet each of the basic federal requirements, but states would have the flexibility to collect minimal information to determine that presumptive eligibility and get subsidy to the family. And except in cases of fraud or intentional program violation, we are proposing that states could use federal CCDF funds for up to 3 months, even if the child was ultimately determined to be ineligible. We believe this proposal would help make sure parents don't miss out on job opportunities because of lack of care. And we are hoping that this flexibility will allow more states to move forward with presumptive eligibility. The NPRM also aims to lessen the burden of administrative requirements on families applying for child care assistance by requiring states use family-friendly enrollment practices, meaning practices that do not disrupt parent employment, education, or training opportunities. Parents report that some of the biggest challenges in this program are long waits at inconvenient times to apply in person and gather the necessary documents. So the NPRM encourages states to simplify enrollment by using a family's enrollment in other public benefit programs or documents, or using other verification from other programs in order to verify eligibility for CCDF. It also encourages all states to offer online subsidy applications. Currently, not all states do that. We think these practices could make a big difference for families needing child care assistance and look forward to helping states move forward with them. So that is the end of our overview of the proposed changes. There are other technical and smaller changes in the NPRM, and we encourage you to read the NPRM very carefully. We think this is going to strengthen the CCDF program in ways that will better serve children, families, child care providers, and their communities. And if enacted, the Office of Child Care is prepared to work in partnership with states, territories, and tribal governments to implement these policies in thoughtful ways that account for the different child care systems and different needs of families across the country. Before turning it back to Megan to walk you through how to submit comments, if you're interested in doing so, I do want to quickly touch on two additional policy areas. First, background checks. I want to assure you that we continue to hear your concerns about the background check provisions in the child care program. I know we all agree that background checks are really important for ensuring child safety while in care, but we have certainly heard and understand that the law's specific provisions have been particularly difficult and expensive for governments to implement and may not always be in the best way to ensure child safety. While this NPRM does not address the background check concerns that you've raised, I assure you there will be ongoing opportunities in the future for us to work together on this important issue. And secondly, this NPRM does not address many of the concerns we've heard about the rules for tribal CCDF programs. We have a separate effort underway on that, and you will be hearing more from us soon about those, and including I will be talking a bit more about it tomorrow at the webinar at noon Eastern time. And with that, I will turn it back to Megan.
Thanks, Ruth. So now that you have information about what's covered in the NPRM, I'm going to switch to discussing the regulatory and comment process as we look ahead. As we mentioned, the NPRM was published today in the Federal Register. This means the comment period has officially started. We will accept public comments until August 28th. There's only one comment period for NPRMs. For those of you who may be more familiar with the Paperwork Reduction Act process, where we have forms published and there are multiple comment periods, the NPRM process is different. It is only the one comment period. Once the comment period closes, the Administration for Children and Families and the Office of Child Care will review and analyze the public comments and use them to inform drafting a final regulation. We expect a final rule in 2024. All comments must be submitted online through regulations.gov. That information is also explained in the NPRM itself, and you can also get that information on the OCC website. You can access the NPRM and the e-rulemaking portal, as it's called, for submitting comments through the links in the slide. This information is also available on the Office of Child Care website, and we will be sharing these slides so you can access the links that way if you are not able, if you need a reference. Public comments are a really important part of the regulatory process. When submitting your comments, please make sure to identify the agency, which is the Administration for Children and Families, and the docket or RIN information so that those comments actually get to us through the system. Also, please clearly identify the issue you are commenting on and include the page and column number and citation to help us better understand and respond to your comment. The comments are also an opportunity for you to let us know where something isn't clear or where you have questions on a proposal. As we've mentioned before, and we'll probably say again, we are very limited in the questions we can answer related to the NPRM. So submitting your questions and requests for clarification through the comment process is an important way for us to learn where we need to be clearer when we publish a final rule. Finally, We are continuing to create and post resources about the NPRM on the Office of Child Care website. Right now, there is a track changes version of the proposed changes to the regulatory language. So it's the full CCDF regs with some with the red line in there, so you can more easily see the changes we're proposing compared to what's published as part of the NPRM, and an overview of the requirements in the NPRM. Several more resources, including a list of where we are specifically asking for comment throughout the NPRM, will be going up shortly. As I've mentioned, because we cannot answer questions directly that are not addressed in the NPRM, we hope that these resources will help you as you review and comment. We encourage you to check back regularly to the website throughout the comment process.
So I think our assistant secretary is joining us, but I cannot tell. Okay, given the silence.
I think she should be here in a minute based on a message.
Yes, I'm told she's nearly here. I do want to slowly, while she joins us, introduce our Assistant Secretary for Children and Families, January Contreras. Assistant Secretary Contreras was appointed by President Biden and confirmed by the Senate with bipartisan support. And she leads us at the Administration for Children and Families to strengthen the well-being of children and families with a focus on prevention, safety, economic stability, and equity. And I'm hoping, oh, I see her name now, that I spoke slowly enough. January, are you on?
Yes, how are you? Thank you, Ruth. I appreciate it. And thanks, Megan. All right, so just very briefly, Ruth, thanks for the invitation to join everyone on this call today. We're very excited about all the work that's been happening under the leadership of this team, and also the announcements that have been made about the proposed rule. So thanks to everyone. I'm sure we've been walking through this very carefully about what the proposal is. And my thanks to everyone who took time out of their day to be with us today to learn about the proposed rule. So many on this call play key roles in childcare across our country. And we know that the parents of our nation have childcare on their minds as well every day. So our work at the Administration for Children and Families and our ability to create policy and to propose change that will have a positive impact on families isn't possible without your involvement, your engagement, and your commitment. So hearing about your experiences as providers, as parents, as advocates, as state and local decision makers, it's just so valuable to the outcome of our work. So for you to be here with us and to have been providing input all along the way to help us arrive here, to take time from your job and your families to be with us today, we're very grateful. I'll just reiterate quickly some points that Ruth and Megan noted today. One, the Child Care and Development Fund provides critical child care assistance for working families with low incomes. That's one huge priority of this money. And secondly, at the same time, these funds also provide child care quality improvement funding for all kids. And that helps a lot of families every day. Now, I get to travel around the country a lot. I hear from families over and over about childcare being a significant expense, really limiting opportunities sometimes for what choices they have in front of them because they can't access affordable childcare. And that's no matter an income level. And at the same time, childcare providers are one of the lowest earning professions in our country. And that's not right. So here at the Administration for Children and Families, We care about the economic and social well-being of families, and that includes access to affordable, high-quality childcare. And it's critical support that ensures family stability and overall economic stability and mobility. We know childcare plays a role in that. So on behalf of President Biden and Vice President Harris and Secretary Becerra and myself, really, we thank you for all that you do to carry the load with parents, for children and families who rely on you. We encourage you to review the proposed changes, to please continue to engage with us by submitting your feedback. We have the federal e-rulemaking portal that I'm sure was discussed, and we welcome your feedback there and really invite you and encourage you to share your feedback. We look forward to receiving your comments and ensuring that the final changes are those that will strongly support families with young children and the child care workforce. So I really want to thank you again for all that you do, and say, let's keep working together and let's keep moving forward. Thank you so much.
Thank you, Assistant Secretary, and thanks to all of you who have joined us today. We look forward to continuing to work in partnership with all of you to do better by kids, families across this country, as well as supporting our wonderful child care workforce. So thank you and have a good afternoon.